bone marrow in the next step, and bone marrow may be taken as just an aspirate, or sometimes a biopsy, a refined biopsy can be taken. So sometimes when we have got problems in the marrow, like aplasia is there, or megaloblastic anemia has to be diagnosed, or myelodysplastic syndromes are there, which are pre-malignant conditions, leukemias, or we have got hypoproliferative anemias, that means there are cytopenias. Here we have to look at the bone marrow. Also, if we are dealing with a case of lymphoma, bone marrow may come handy to look at the picture of the marrow, which may tell us what is the stage of the lymphoma. Megaloblastic, we may not do it routinely, but sometimes rarely we may have to do it. Then for diagnosing infections, especially tuberculosis of the bone marrow, Kala Azar, or maybe sometimes in pyrexia of macrolesion, or for diagnosing conditions like the myelofibrosis, or red cell maturation defects, or infiltrative diseases of the bone marrow, which may also give a lot of. So this is the procedure by which the bone marrow is done. Sometimes it is taken from the posterior superior iliac spine, or it may be taken from the tibia also. So basically this is a bone marrow aspiration. A needle is inserted and aspiration is done. But sometimes we may require to see the whole marrow, and not just the cells which are aspirated, and we might like to see the tissue of the marrow, and then a bone marrow biopsy is done. These are the sites. It can be done in the tibia, it can be done in the body of the sternum, or it can be done in the iliac crest or the posterior superior iliac spine. Commonest is the posterior iliac spine. Well, these are the contraindications in case there is some local infection, or in case there is some hemorrhagic disorder which is severe. In that case, we might have to knock in the bone marrow. Now the lineages of the hematopoietic cells which are seen here are the erythroid, granulocytic and megakaryocyte, myeloid cells basically. So normal marrow shows a mixture of both the developing cells, which are blasts, and mature cells which are ready to be released into the bloodstream. There may be sometimes other cells also in the bone marrow, like the lymphocytes and plasma cells, or developing lymphocytes, which are called lymphoblasts. A term used is left shift. If the pathologist sees more developing cells than normal, it is called a left shift. That means if blasts are seen more, or developing cells are seen more, if they are identified more, then we say that the marrow has a left shift. Maturation arrest is a term which is used when the cells they stop maturing. We may find abnormalities in the bone marrow. We may find that it may be diagnostic for leukemia, metastasis, lymphoma. This is the appearance of a normal marrow. The whitish spots are the fat, and rest of it is the rest of it are the cells which are developing. Myeloid erythroid ratio is a very important thing, because when we look at the marrow, 65% are the granulocytes and their precursors. They are the largest. 25% are the erythroid precursors, and 10% only are the lymphocytes, monocytes, and their precursors. So if we take into consideration the white blood cells and the red blood cells, or the myeloid cells and the erythroid cells, then the myeloid erythroid ratio is supposed to be 2:1 or 3:1. So 2:1 or 3:1 is the normal myeloid erythroid ratio. So in myeloid series we may see developing WBCs like the myelocytes, metamyelocytes and granulocytes, or in the erythroid we may see normoblasts or pronormoblasts. Now, if the myeloid erythroid ratio shows increased ME ratio, it means that the patient is having either increased production of WBC as such in leukemia, or maybe decreased production of RBC as in erythroid hypoplasia. Decreased myeloid erythroid ratio may mean decreased production of granulocytes and increased production of erythrocytes. Earlier, bone marrow was also required to assess the iron stores, and a special staining technique which is called Prussian blue stain was done, but now it is thought that serum ferritin is a good indicator of iron stores. Myelofibrosis can be seen very well with the bone marrow, and infiltrative diseases of marrow may be also well visualized by bone marrow examination. कितने